Now we'll continue talking about the disorders of red blood cells. And let me start by some review of the physiology of red blood cells. So as we mentioned earlier, red blood cells occupy 45% of the blood volume, and this value is known as the hematocrit. Red blood cells are responsible for oxygen delivery to tissues, and they are very well equipped for their function because they have nothing inside them but hemoglobin. They do not have nuclei. That's why some pathologists call them red blood corpuscles and not cells. And they have a shape and structure that enables them to do their job perfectly. So let me use the whiteboard again. So if you look at a red blood cell from the side, what do you think? Does it look like this? Or it looks like this? If you look to a red blood cell from the side, you will notice that it looks like a biconcave disc. And why does it have this look? Because it makes oxygen molecules that are inside the red blood cells, even the oxygen molecules that are in the middle of the red blood cell, very accessible to the cell membrane, and therefore can be very easily delivered to tissues. In contrast to the spherical pattern, so these oxygen molecules that are inside the red blood cell in its middle are not that accessible to the cell membrane. So the biconcave disc enables better oxygen delivery. Biconcave discs for better oxygen delivery. Not only this, but the cell membrane of red blood cells, the cell membrane is very flexible, very, very flexible. And this enables the red blood cells to squeeze themselves into very tiny blood vessels. So if they pass through very, very, very tiny capillaries, this biconcave disc with a flexible cell membrane can squeeze itself, and so that the red blood cell can go inside tiny capillaries, and then after they get outside, or after they get out of this tiny capillary to a bigger venule, they resume their original size and shape. So this is called reversible deformability. And this reversible deformability is because the cell membrane is very flexible. There is one congenital defect of red blood cells where babies are born with spherical red blood cells and also the cell membrane is very rigid or not flexible. Rigid or not flexible cell membrane. So imagine the red blood cell is a sphere, not a disc. This in itself will make it harder to pass through tiny capillaries. And the cell membrane is rigid and not flexible. So imagine you have this sphere wants to pass through this tiny capillary. It will not happen. It's going to squeeze itself but the cell membrane is rigid, is not going to help it. So what happens is the cell will rupture. The cell will rupture. So you're losing red blood cells inside your body. What do we call this? We call this hemolysis. And when millions of red blood cells hemolyze, you will have low number of red blood cells, low hemoglobin, low hematocrit, and this is anemia. And because this anemia happened because of hemolysis, we call it hemolytic anemia. And this hemolytic anemia is characterized by spherical red blood cells. So we call it congenital or hereditary spherocytosis. So hereditary spherocytosis, this is a hemolytic anemia in which the red blood cells are spheres and their cell membrane is rigid, and usually they hemolyze because when they try to pass through tiny capillaries, they hemolyze. And actually, the organ in the body that has the smallest capillaries ever is the spleen. And this is where most of the hemolysis occurs. And this is hereditary spherocytosis or congenital spherocytosis. Going back to the PowerPoint, the lifespan of red blood cells normally is 120 days. So they keep circulating, doing their function perfectly for 120 days. And after that, when they get older than that, they are destroyed in the spleen. When they pass in the spleen, the macrophages in the spleen will identify the old red blood cells and will phagocytose them and process them and ingest and process their components. What is inside red blood cells? Nothing but hemoglobin. Nothing but hemoglobin. So let's talk about the structure of hemoglobin more thoroughly. A single red blood cell has as many as 300 million molecules of hemoglobin. For simplicity, let's say it's 250 million of hemoglobin molecules. You will know why I chose this 250. The hemoglobin, as the name implies, is made of globin, which is a protein, and heme. It's heme and globin. Heme and globin. The globin includes two pairs of polypeptide chains. The adult hemoglobin or the adult globin has two alpha chains and two beta chains. Two alpha chains and two beta chains. That's the adult hemoglobin has two alpha chains and two beta chains. In the middle of each globin chain, there is the heme. And the heme is this, the heme unit is this red disc. Each heme molecule, to each heme molecule is attached one iron atom. So that's in black. This is iron atom attached to each heme unit. How many heme units we have? We have 4 heme units, which means the single hemoglobin molecule has 4 iron atoms. Each iron atom can carry 1 oxygen molecule. Each iron atom can carry 1 oxygen molecule, which means the single hemoglobin molecule can carry 4 oxygen molecules. So a single red blood cell has 250 million molecules of hemoglobin. Each molecule of hemoglobin carries 4 molecules of oxygen, and this means the single red blood cell can carry 1 billion oxygen molecules. Imagine 1 billion. That's the single red blood cell. And how many red blood cells do we have in a single drop of blood? 5 million. Enormous, enormous amount of oxygen. And guess what? Out of this huge amount of oxygen, the red blood cell does not take a single molecule for its own metabolism. Why? Red blood cells do not metabolize aerobically. Why? Red blood cells do not have mitochondria. So red blood cells just metabolize anaerobically. They do not take oxygen for themselves. So they carry, imagine yourself carrying a bag with $1 billion inside, and you're not taking a single cent for yourself. You're distributing all these dollars. So red blood cells just distribute oxygen without having anything for themselves. Now, if you have abnormal hemoglobin, we call this condition hemoglobinopathy. We call this condition hemoglobinopathy. What's hemoglobinopathy? It's a pathy in your hemoglobin. It's a pathology of your hemoglobin. Where the pathology can be. If the pathology is in the globin part, sometimes you are born with one alpha chain missing, and we call this alpha thalassemia minor. If you're born with your 2 alpha chains missing, we call this alpha thalassemia major. By the same token, if you're missing beta chain, that's beta thalassemia. And in all cases of thalassemia, you have hemoglobinopathy. When you have hemoglobinopathy, your red blood cells are weaker than normal, which means they are not going to live for the 120 days, and they will be destroyed earlier than that. Usually they are destroyed in the spleen. And again, when your red blood cells are lost inside your body, we call this hemolysis. So thalassemia is another type of hemolytic anemia. So we already mentioned congenital or hereditary spherocytosis as one type of hemolytic anemia, and here is the second type of hemolytic anemia, which is thalassemia. Another hemoglobinopathy is sickle cell anemia, and sickle cell happens because there is a genetic mutation in the hemoglobin beta chain where you put the amino acid valine instead of the amino acid glutamic acid. And because of this, the red blood cell again will be abnormal. Maybe it can function normally until the patient is subject to any type of stress. And what's the most common cause of stress in the human body? Infection. Once this hemoglobin is exposed to stress, the red blood cells will start to sickle and will acquire this crescent shape, and this crescent shape will result in blocking tiny blood vessels, causing vaso-occlusive crisis, and eventually the red blood cells rupture. And again, that's another type of hemolytic anemia, which is sickle cell anemia. Okay. So back to the physiology of red blood cells. Red blood cell can carry, a single red blood cell carries 4 molecules of oxygen. Usually, normally, when red blood cells pass through tissues, they liberate only 1 molecule of oxygen. So even the venous blood returning to the heart is like 75% saturated with oxygen, because only 1 oxygen out of the 4 molecules is given to tissues. Of course, when red blood cells pass through tissues with more need for oxygen, with more need, like during exercise, your red blood cells can identify that you are exercising, because exercising tissues liberate carbon dioxide and the temperature is higher, and there is some type of acidosis, low pH in exercising tissues. All these factors will make the hemoglobin more generous, and instead of delivering 1 molecule of oxygen, the single hemoglobin molecule will deliver 2 molecules of oxygen. So the hemoglobin will be more generous. When we express this in a graph, we say that the oxygen hemoglobin dissociation curve shifts to the right in metabolizing, in exercising tissues, which means the hemoglobin becomes more generous. And also in anemia, when you have lower amount of hemoglobin, the blood will sense that, and the blood will become more generous in delivering oxygen. Think of it like you order pizza, and the pizza place has deficiency in the number of the delivery guys. So if they normally have 200 delivery guys, and each delivery guy delivers 1 pizza, if now they have only 100 delivery guys, they give them more pizzas to deliver. So the delivery guys will be kind of more generous. They distribute more pizzas. Same with anemia. When the total amount of hemoglobin is low, whatever hemoglobin is there becomes more generous, and the oxygen hemoglobin dissociation curve is said to shift to the right, and this means more delivery of oxygen. Okay, in the coming segment, we're going to talk about the life cycle of the red blood cell, and we'll talk about the different major 2 categories of anemia.